My name is James Dannelly, and I'm here today to talk about men's health disparities. In the United States, a lot of focus is given to women's health, and without minimizing any of the disparities that are there, it's important that we as healthcare providers also recognize that there are many disparities in men's health, and in fact, worldwide, from all measurable statistics, from participation, comorbidity, outcome, life expectancy, men are kind of worse off than women across the spectrum. These disparities are actually higher in countries with a higher GDP. In America, fares among some of the worst as far as disparities go between men and women. This is important to me because as both a man and a healthcare worker, I've kind of seen both sides of the coin in healthcare, and it's my view that if we improve the healthcare of men, we're improving the healthcare of America. Both because half the population is men, but also the lessons that we use to improve healthcare for men can be applied to other groups. We're going to be doing this through the lens of the educated citizen, which is being an effective communicator, a reflective individual, and a change agent. These are all important skills that we need to have as citizens, but also as healthcare providers to provide the best care for our patients. A situation where I used effective communicator skills to make a change for my patient was I had someone who was very non-compliant, and willfully so, because they did not want other people telling them what to do, even when that was their doctor or their nurse. Through sitting and kind of talking with them, I was able to identify really what their goals were as a patient. Now, they were not concerned with getting their hypertension or their diabetes under control in kind of a broad sense to have better health, because their goal was to go out and do what they wanted, which was hunt, fish, go out to dinner, enjoy a ball game, and really enjoy their retirement. But talking with them and identifying what the barriers to those activities were, well, it was really their health that was holding them back. So using that to help educate them that by getting their hypertension and diabetes under control was a means to an end for them to achieve their goals. The learning I took away from this was that we really need to identify what matters most to our patients, not so much what we are concerned with, being lab values and diagnostics like that. How this applies to men is a lot of men have a societal self-identification as being self-reliant, autonomous, and experts on whatever topic happens to come about, and presenting challenges to those things can really cause a conflict of identity within these men. Redirecting some of our care plans to allow for a maintenance of those self-identifications can help foster greater compliance with the healthcare recommended. Another situation was I had a man who was underreporting his pain level, and it was very clear that he was doing so, but the staff nurse really couldn't understand why. Now, he was the only patient I was assigned that day, while she had, I believe, 5. So I had nothing to do other than really sit and talk with him. Through doing that, we kind of identified that the reason that he was underreporting it is he had a history of substance abuse with opioids, and was afraid that any medications he was given would trigger a relapse. So being an effective communicator and developing sort of that therapeutic milieu that we talk about, I was able to build trust with him to where he was willing to confide in me the real reasons behind why he was refusing pain medications. We were able to come up with a plan that was using non-opioids to control his pain. The learning from that is we really need to be effective communicators to develop that therapeutic milieu. Common ground and trust and respect are essential to giving, best care to our patients. How this applies to men's health is, again, like our previous scenario, a lot of men have that self-identification as being stoic, and a lot of healthcare problems that show some of the lowest levels of participation are ones that still have stigma around them. That is mental health, substance abuse, even sexual health. And so we need to build that trust and that therapeutic milieu, really, to help foster a better outcome for our patients. As a reflective individual, one situation where I struggled with as a patient who had a extended hypoxic period and afterwards had a Glasgow coma of about 4. The realistic prognosis for this person was long-term care and a persistent vegetative state. However, their family practiced a faith-based healing and presumed a full recovery through prayer and positive thinking. The conflict kind of came up where any talk about extended care and more realistic prognosis as we understood from modern science, they viewed as negative energy and detrimental to the patient's health. So finding a collaboration where we were able to give our best recommendation to them and best cares while still preserving their belief structure was difficult. The learning that I took away from this was that while I may have a modern Western view of medical science, other people who have different views and different worldviews, we need to preserve their autonomy and respect, and really the respect for the patient and their wishes, so that we can come to a collaboration on how to best help this person. As this applies to men's health, there are a lot of beliefs that are contrary to Western medicine about men's health. To find a collaboration with our patients, we really have to divest of ourselves of, some of our personal beliefs and views, and allow them to find really what is best for them, even if it runs contrary to our understanding of medicine. Another individual situation, here in the United States, and specifically in the Midwest, we have circumcision rates that are approximately 30 times higher than anywhere else in the world, with the exception of some countries that mandate it as a religious practice. Caregivers often cite that the therapeutic effects of circumcision make it worthwhile. However, it is only in the United States that there is any evidence that there is positive therapeutic effects. My view is that this comes from this cultural bias that we have here in the United States, as well as perhaps that it's a billable expense that the person recommending it can have. The learning that I took from this is that I have had to change my views on topics based on emerging evidence. However, others may not change their mind based on the evidence and how they interpret it. But really what is best for our patients is, having a respect and professional nature with our colleagues, and really having a collaborative team dynamic to give the best care we can to patients and allow them to, make their own decisions, I guess. As this applies to men's health, there are a lot of cultural customs that run contrary to modern science and evidence, not limited to men's health care. And so throughout healthcare, we have to recognize that differing opinions based on the same evidence really are not conducive to patient care, but a collaborative team effort is what's going to be best for our patients. Most of you know that I am a member of a medical platoon in the U.S. Army, and one of the things that I identified was that we had a focus on emergent combat trauma. However, the majority of patients that we have are similar to civilian pathologies, where they're mostly routine and medical in nature. As a result, we have lost a lot of the skills for assessment, and that, of course, is problematic for our patients. So I developed a training plan that included more of those common and realistic patient scenarios. The learning I took from this is that all cares and procedures and assessment skills that we have are perishable. And so we need to continue to train and learn in realistic scenarios based on the evidence that we have. As it applies to men, they have a tendency to neglect care until it becomes systemic with comorbidities and other catastrophic things. And so again, sort of shifting a worldview that includes holistic preventative care can improve the patient-centered care that we have, both for men and across other populations. Another situation is the clinic that I used to work at served a high number of Latinx patients, and frequently we would identify that there was a problem with identifying who these patients were, whether it was a social security number that was already identified with another patient, or they gave us an ID that was clearly a fake. This is a conflict with the 5 rights that we have of providing good health care. And likely, most of this was due to the patient's legal status here in the United States. The learning I took from this is that we as healthcare providers really need to advocate for policy change as well as patient education, that as a healthcare community, we're not really responsible for their legal status here in the United States, and also to ensure that we're able to provide care for a patient without jeopardizing their status here in the United States. In conclusion, we can use our skills as educated citizens to effectively communicate, reflect, and be a change agent to identify, recognize, and mitigate some of the disparities that there are in men's health. And this can lead to better cares both for individual patients and the communities in which these men reside. We can then use those lessons learned to apply to broader populations and really provide greater health care for all communities and all populations. Here's a list of my references, and thank you for listening.